And it's those patients where the HPV persists, they're at the highest risk of cancer. So like, yesterday, 2 days ago, I saw a patient in the office and she's had HPV for several years. And so I told her, you need PAPs every year. Although we don't do PAP screening every year on everyone, there's some patients that we know are at the higher risk because their HPV lingers or for some reason it doesn't go away. Normally your immune system is what fights the virus. So, we talked about in the session about, proper diet, reducing stress, all that plays an important part of the HPV actually going away. I love this slide. It's from the New England Journal of Medicine. It kind of shows how the HPV virus gets through the skin. So on the surface of the cervix, actually, there'll be tears, whether that's through infection, through trauma. Those tears can allow the HPV virus to get into the basal layers of that lower purple layer is where the HPV virus will integrate into the cells and actually divide and grow. So that's kind of how, we know that HPV gets infected to the cervix. And this is a really great slide. Now, these studies were done many years ago, I think in South America, where unfortunately, kind of like the Tuskegee Institute, patients weren't treated, they were just followed to see what happens. And of course, we don't do that anymore, but we do know from natural history studies that in patients that get infected with the HPV virus, a lot of times, that virus will clear. And it can cause changes on the cervix, and that's usually when you get your Pap test, your doctor may say, oh, your Pap is abnormal, I'm going to repeat it. A lot of times we repeat it because we do know the HPV virus infection will clear and those changes will resolve on their own. So there's this, clearance that can happen. Now let's say you get an abnormal Pap and you don't go back for a couple of years. Let's say life got busy and you forgot. Well, then you can have progression. And so if you have progression, you have that precancer lesion. So the patient I mentioned that I saw in February 2021, she actually had seen her GYN doctor and she had a biopsy and she was told she had CIN3, which is severe dysplasia or the step right before cancer, but she didn't have health insurance. So the doctor told her the cash pay price was $800, well she didn't have $800. She was a hairdresser and then COVID happened, COVID had happened and just time had elapsed. And unfortunately, her disease progressed. But a lot of times that's when we can intervene, when we know that someone has, an abnormal biopsy, we can treat that. And a lot of times those patients go back to normal. We just follow them more closely. Of course, they don't get PAPs, every 3 to 5 years. They'll get them still every year because they're at the highest risk.